All right, so thank you for those numbers. Now let's get a better picture of the situation here on the local front with our Kim YEON-SEUNG. YEON-SEUNG, welcome back.
Thank you for having me, Sunhee.
Right, so the Greater Seoul area is now feeling the strain of surging caseloads. Tell us more.
Yeah, you're absolutely right, Sunhee. So the beds in the Greater Seoul area are filling up very quickly. As of now, ICU beds in the Seoul capital region are more than 78% full. This figure has been rising by 1 to 2 percentage points per day. More than 400 patients in the Greater Seoul were left waiting for their beds on Thursday. Hospitalized specialized in infectious diseases are also nearing their limits, with more than 3/4 filled in the Greater Seoul area and over 60% full in other regions. Now, as we move forward with the gradual easing of restrictions, it's absolutely imperative that the healthcare sector is capable of handling the growing number of COVID patients and critical cases. Although regions outside the capital still have some headroom, the Greater Seoul area appears to be on the verge of overcapacity.
Right, and in light of that scenario, what has been the response, YEON-SEUNG, from health authorities?
Well, health authorities are really trying to tackle this issue from all angles. The Ministry of Health and Welfare made an announcement Friday morning on some of the measures they were taking. So first, they've almost doubled the allocation of home treatment in the past 2 months. They're also designating more hospitals specialized in infectious diseases, a move that will add up to 600 more beds. Under the previously issued administrative order, officials are currently working to secure some 1,000 beds. But as I mentioned in my previous reporting, I'm sure you remember, Sunhee, even with the extra beds, there needs to be enough medical staff on site to handle the growing number of patients. Here's more from South Korea's health minister.
We are currently in the process of securing 1,312 more medical staff, and we've already found 505 more people who can start working immediately in ICUs.
So authorities are also zeroing in on care centers and nursing homes where many cluster infections have occurred. Care workers at these facilities in the capital region will be required to get tested twice a week, and visitations will not be allowed. Workers and inpatients at nursing homes are also eligible to get their booster shots 4 months after their primary doses, so earlier than most people.
Right. So essentially, YEON-SEUNG, authorities are doing all they can, that is, to contain the latest situation, while at the same time allow for a transition to a new normal then.
Yes, exactly. Well, authorities really seem eager, just as anybody else, to really move forward with easing the measures. So there was also a special request from the Blue House Thursday afternoon, with President Moon Jae-in urging government officials to stabilize the situation. He asked them to take special care so that everything runs smoothly, from the fast-tracked booster campaign to the securing of extra ICU beds. He asked the nation's people to stay calm and follow the government's prevention guidelines and the recommended dates for vaccinations. He also added that the road back to normal won't be an easy journey, especially judging by the situation in other countries that have taken easing steps ahead of South Korea.
Right. All right, YEON-SEUNG, thank you for that, but do stay with us for the extended talks.